Hi guys, Dr. Kid here. In this video, I'm going to show you how I diagnose polycystic ovarian syndrome as a doctor and the official diagnostic criteria I use to make this diagnosis. Now, a really quick disclaimer, this video is not for you to diagnose polycystic ovarian syndrome in yourself. It's just to give you an idea and some general information that you can further discuss with your doctor if you're considering a diagnosis of polycystic ovarian syndrome. Now, the most commonly used diagnostic criteria for polycystic ovarian syndrome is known as the Rotterdam criteria. And it is actually quite simple. Now, the Rotterdam criteria states if you have 2 out of the 3 following criteria, you have polycystic ovarian syndrome. The 3 criteria are 1, irregular periods, 2, signs of hyperandrogenism. This means signs that you have higher testosterone than normal, and 3, multiple cysts on your ovaries. Now, it sounds pretty simple, right? As long as you have 2 out of the 3 criteria, you basically have the diagnosis. Like most things in medicine, not everything is that straightforward, but I'll just go through some of the things that you need to know when making this diagnosis. So the first thing you need to be aware of is that you have to have no other explanation for these signs and symptoms. So in particular, you need to rule out other conditions that may cause irregular periods and these signs and symptoms. The classic ones you see in textbooks is Cushing syndrome and congenital adrenal hyperplasia. These are 2 ultra-rare conditions, but they are important to rule out. There are many other causes of irregular periods that need to be ruled out, such as significant stress, significant change in exercise habits, thyroid dysfunction, high prolactin levels. These are just some examples that you need to rule out before you diagnose polycystic ovarian syndrome. The next thing to be aware of is the exact definition of the 3 criteria, which sometimes can be misinterpreted, and I want to go through each individually. So the first definition is irregular periods. This is defined as women who have menstrual cycles that are longer than 35 days or less than 21 days. One example I do see is that I have some patients that have periods every 33 days. Now for these patients, it looks like they actually skip periods some months, but when you actually calculate it out, they are still having periods regularly every 33 days. So this is one example where you're just going to be a bit careful when diagnosing irregular periods. Another time you have to be careful when diagnosing irregular periods is when a woman starts having the period for the first time. It's not uncommon to have irregular periods for the first 2 years once you start your menstrual cycles. The second criteria is signs of hyperandrogenism, meaning high testosterone. Now you can diagnose this in 2 ways. You can diagnose it clinically, which is just signs and symptoms of the patient. Typically the signs we use is hirsutism, which is excessive facial hair on the face, or excessive acne can be another sign of high testosterone levels. Now, the other way you can also diagnose hyperandrogenism is by doing a blood test, and the best marker to look for is free testosterone. So this can be done by either measuring free testosterone or measuring a blood test known as the free androgen index. If any of these are high, that also meets the criteria for hyperandrogenism. The last criteria is having multiple cysts on your ovaries or polycystic ovaries. This can be diagnosed with ultrasound, where if you have more than 20 follicles on one or both of your ovaries, and you also have an increased size in your ovaries, usually above 10 mils in size. This will help you meet the criteria for polycystic ovaries. One population you have to be very careful when you're diagnosing polycystic ovaries is young people, because young people commonly have a lot of cysts in their ovaries. So definitely be very careful when diagnosing polycystic ovaries in someone under the age of 25 and particularly under the age of 20. So that's the 3 diagnostic criteria for polycystic ovaries and some common pitfalls that people can fall into when trying to make the diagnosis. If you think from this video that you might have the diagnosis, please see your doctor to confirm it. This video is only for general information only. So the last thing I just want to cover is why it's important to diagnose polycystic ovarian syndrome. Well, polycystic ovarian syndrome increases your risk of insulin resistance and diabetes. And that is why patients that get diagnosed with polycystic ovarian syndrome, we much more closely monitor their blood sugar levels. Another important reason that we want to diagnose polycystic ovarian syndrome is its implications for fertility. Often these patients, it is a bit harder to get pregnant because often they're not ovulating. That is why it's important to diagnose so we can plan around pregnancy when the patient wants to have kids. So that's my summary on how you diagnose polycystic ovarian syndrome. If you found this video helpful, make sure that you like and subscribe to my channel, and I'll catch you in the next video.